What if the vitamins you take every morning, believing they're making you healthier, could actually be silently harming you? Imagine this. According to clinical data from the JMA, seniors who take the wrong supplements are at a 40% higher risk of premature death. This isn't some exaggerated claim, it's a chilling reality. There's one vitamin on this list that's been linked to brain shrinkage. Another one, it increases your risk of stroke, nerve damage, and heart failure even when taken in normal doses. And chances are, you're probably taking it every single day. After 65, your liver slows down, your kidneys can't flush out excess nutrients the way they used to, and your nerves become more vulnerable. Yet these vitamins build up, poison your cells, and create symptoms that we mistakenly attribute to simply getting older. But here's the truth. It's not age, it's avoidable. In this video, we'll uncover the 2 dangerous vitamins you should avoid after 65, and the 2 that you absolutely need to take daily. Stay tuned until the very end because vitamin number 1 is linked to a 36% lower risk of death from all causes, according to a major European study. Before we dive in, drop a comment and tell us where you're watching from. But first, let's talk about the harmful ones. Starting with a vitamin that may seem harmless, but can quietly cause serious damage over time, vitamin A in its retinol form. 2 dangerous vitamins that all seniors need to be careful when taking. The hidden dangers of vitamin A after 65. Vitamin A, often touted for supporting vision, immune function, and skin health, may seem like one of the good guys. However, for those over 65, especially individuals taking multivitamins or liver-based supplements, excess vitamin A, particularly in the form of retinol, can accumulate in the body over time, leading to toxic overload. Here's why. Vitamin A is fat-soluble, meaning it is stored in the liver and fatty tissues rather than being excreted like water-soluble vitamins. As we age, our liver slows down and fat stores change, causing vitamin A to build up. This gradual accumulation can result in symptoms like dry skin, dizziness, blurred vision, and joint pain, often mistaken for the natural effects of aging. But these could actually be signs of chronic vitamin A toxicity, particularly if you're taking more than 2,000 to 3,000 micrograms per day from supplements. In a 2022 review from the European Journal of Clinical Nutrition, excessive vitamin A intake in older adults was linked to a 25% increased risk of atrial fibrillation, a dangerous irregular heart rhythm that significantly raises the risk of stroke after age 65. If you're over 65 and still taking a supplement containing retinol or retinol palmitate, it's time to reconsider. While your body needs vitamin A, it's safer to obtain it from natural sources like sweet potatoes, carrots, spinach, and eggs, where it's present as beta-carotene. Beta-carotene is safer because your body only converts it into vitamin A when needed, making the risk of overdose virtually zero. So, if your multivitamin contains retinol, check the label. Anything over 700 micrograms per day for women or 900 for men can be harmful, especially in the long term. The safest approach is to ditch the synthetic version and stick with real, natural food sources. The iron trap: why seniors should avoid iron supplements. Iron is essential for our health, but for seniors, it can become a hidden threat. Many people over 65 take iron supplements just in case or to combat fatigue, anemia, or brittle nails. However, after 65, the body stops losing iron the way it used to, and this excess iron doesn't disappear, it accumulates in the liver, heart, and pancreas. Unlike water-soluble vitamins, iron is stored in the body. Over time, too much iron causes oxidative stress, which damages cells, inflames tissues, and accelerates the aging of organs. It also promotes the formation of lipid peroxides, compounds linked to Alzheimer's, cancer, and heart disease. The issue is that most seniors don't need extra iron. Men stop losing iron after puberty, and women stop after menopause. Unless you have a diagnosed iron deficiency or have lost blood due to surgery, ulcers, or chronic disease, you're likely getting enough iron from your diet through meats, beans, leafy greens, and fortified cereals. Adding iron supplements on top of this can tip the balance and cause harm. The symptoms of iron overload, like joint pain, fatigue, memory issues, or heart palpitations, are often mistaken for aging. But behind the scenes, excess iron is silently damaging the brain, liver, and heart. If you're taking a multivitamin with iron, it's time to stop and consult your doctor. A simple test can check your iron levels. If they are too high, you may need to reduce red meat and discontinue iron supplements. A better option is to choose an iron-free multivitamin, especially for seniors. Iron might be necessary when we're younger, but after 65, it's like adding fuel to a fire that your organs can no longer extinguish. Magnesium is a critical nutrient, but it's often overlooked, especially as we age. By the time you're over 65, your body's magnesium stores likely decrease significantly. This happens because as we age, our ability to absorb magnesium declines and our kidneys excrete more of it. Many common medications, such as diuretics, acid blockers, and blood pressure pills, further deplete magnesium levels. Magnesium deficiency can lead to symptoms such as fatigue, muscle cramps, poor sleep, anxiety, irregular heartbeat, and even insulin resistance. These symptoms tend to develop gradually and are often mistaken for normal aging. However, when magnesium levels are restored, many seniors report improvements in sleep quality, better balance, fewer muscle cramps, and even enhanced cognitive function. Magnesium plays a crucial role in over 300 enzyme systems in the body. It helps regulate blood pressure, supports nerve and muscle function, stabilizes blood sugar, and keeps the heart rhythm steady. In fact, magnesium deficiency has been directly linked to an increased risk of conditions such as dementia, atrial fibrillation, and type 2 diabetes. However, not all magnesium supplements are effective. Common forms like magnesium oxide are poorly absorbed and may cause digestive issues. For seniors, more bioavailable forms such as magnesium glycinate, magnesium citrate, or magnesium malate are better options. These are gentler on the stomach and are absorbed more efficiently by aging bodies. The ideal dose for seniors is between 250 to 400 mg per day, depending on their diet and overall health. Magnesium can also be obtained from foods like leafy greens, avocados, pumpkin seeds, almonds, and black beans. However, due to soil depletion, magnesium content in food has decreased, making supplementation often necessary, especially if you take multiple medications. As a doctor specializing in geriatric health would advise, it's essential to ensure you're getting adequate magnesium, especially if you're on medication. Always check with your healthcare provider before starting supplementation to ensure you're taking the right dose for your specific needs. Vitamin D3 is not just important for bones, it's one of the most crucial hormones in your entire body. After age 65, your ability to produce vitamin D3 naturally drops by more than half. This is because, as we age, our skin becomes less efficient at converting sunlight into vitamin D, and factors like spending more time indoors, using sunscreen, or living in northern latitudes can further lower blood levels of vitamin D3 without you even realizing it. The consequences of low vitamin D3 levels are serious. It's linked to fatigue, bone thinning, muscle weakness, poor immunity, and a higher risk of infections. Even more concerning, a major 2020 review in the British Medical Journal found that seniors with vitamin D3 deficiency had a 50% higher risk of respiratory infections and a 30% higher risk of dying from all causes, including heart disease, diabetes, and even certain cancers. Vitamin D3 plays a vital role in immune function. It activates immune cells, reduces chronic inflammation, and helps your body repair damaged tissue. People with higher levels of vitamin D3 not only get sick less often, but they also recover more quickly. In the brain, D3 supports memory, cognitive function, and mood stability. Low levels are strongly associated with depression and an increased risk of dementia in older adults. Here's the problem: most seniors are deficient, and most multivitamins don't contain enough vitamin D3 to correct it. The recommended dose from food and sunlight is 600 to 800 IU per day, but studies show that most older adults need 1 0.000 to 2.000 IU daily just to maintain healthy blood levels. In the winter months, you may need even more, especially if your D3 levels are already low. The best form of vitamin D to take is cholecalciferol, vitamin D3, as it's better absorbed, more bioactive, and closer to the form your body produces from sunlight. It can be taken in liquid, soft gel, or capsule form, and it's best absorbed with meals containing fat. As a doctor specializing in geriatrics, I recommend regular vitamin D testing and guidance from your healthcare provider to ensure you're getting the optimal dose. Remember, vitamin D3 is more than just bone health, it's essential for overall well-being, and as we age, we need to pay extra attention to maintaining healthy levels. In the end, it's not about more, it's about smarter. Just because a label says for seniors doesn't mean it's the right choice for you. The key lies in understanding what your body truly needs, the right nutrients in the right form at the right dose for your age, your unique body, and the future you want to build. Too many of us fall into the trap of piling on more supplements, thinking they're the magic fix when in reality, it's the excess and the wrong choices that can do more harm than good. It's time to cut the toxic extras, to be intentional with what we take, and most importantly, to give ourselves the support they need to stay strong, mobile, and sharp. Our bodies deserve the care and respect that comes from smart choices, not just convenience or trends. So, take a look at what's in your medicine cabinet right now. What are you truly giving your body? Drop a comment below and tell us which vitamin shocked you the most, or if you've made any changes that have worked for you. If this video opened your eyes, tap that like button and don't forget to subscribe. We're here to break down the science that helps you live stronger, longer, and healthier. And if you have any questions, or if you want to share your experiences with us, feel free to leave a comment below. Thank you so much for watching and for taking charge of your health journey. Together, let's make the next chapter of our lives our healthiest one yet.